Assalamualaikum and hi everyone. Our topics today is epidemiology of kidney cancer. Hope you enjoy this video. Every person has two kidneys which are located above the waist on both sides of the spine. These reddish-brown bean-shaped organs are each about the size of small fish. They are located closer to the back of the body. Function of kidney are filter the blood and produce hormones. However, these functions will be impaired when there is uncontrolled growth of abnormal cells in kidney that lead to kidney cancer. There are three types of kidney cancer cells, which are clear cell RCC, papillary RCC, and chromophobe RCC. Now, here is the list of kidney cancer symptoms. What are the risk factors of kidney cancer? The actual cause is remain unknown. However, the associated risk factor with cancer development are listed below. Now, let's proceed to incidence and prevalence of kidney cancer. Kidney cancer is one of 10 most common cancers affect men and women. In USA, African Americans and American Indian or Alaska Natives more prominent to diagnose with kidney cancer. However, in Malaysia, kidney cancer is 14th most common among male and 23rd among female. The incidence of kidney cancer in Malaysia is 1.9 per 100,000 and the incidence is equal among Malay and Chinese.
However, they found out that Chinese population had significantly more advanced age and their mean age was significantly older than Malay. Patients above 40 years old had significantly more advanced tumor due to the cultural background and belief of the older generation who seek alternative therapy first. The lifetime risk of developing kidney cancer in men is about 1 in 46 while women 1 in 82 due to the different risk factor. Next are the characteristics of the risk population. First, 20% of kidney cancer patients are smokers. Second, are due to occupational exposure to chemical carcinogens. Third is the radiation. Fourth is analgesics such as paracetamol and salicylic will increase the risk of kidney cancer if taken in long term. Fifth is due to inherited where it increases the risk of kidney cancer from 4 to 7 times. Patients with von Hippel-Lindau syndrome had increased the risk to get kidney cancer by 40 to 60% to the patient. The risk of kidney cancer increases by 7% with an increases in the BMI. Malaysia is a middle-income country. Do you know, in 2018, 25,000 kidney patients in Malaysia are still waiting to undergo kidney transplant. However, only between 30 to 40 kidneys are available for transplant every year. In 2009, 92% of the patients on renal replacement therapy in Malaysia were on dialysis. For your information, the average cost of kidney transplant range from 29k per life year for adult and 51k per life year for pediatric. The costs are favorable than the annual cost of chronic hemodialysis. The major component of the cost was related to the prescribed medication. Second largest component of cost was for investigation and procedures, and the third one is the cost component of the total overhead costs, which include the cost of lands, building, utilities, and emolument. To conclude, there is a great difference in the incidence of kidney cancer in the world. The most important risk factors for kidney cancer were smoking, occupational exposure, and inheritance. Malaysia's kidney transplant rate is among the lowest in the region and in the world. Even kidney transplantation in Malaysia is cost favorable. Thus, we need to change the perception of kidney donation, saying there were no health risks to donors besides it being a noble thing to do. For the Islamization, Prophet Muhammad had said, "Yes, O you servant of Allah, take medicine as Allah has not created a disease without creating a cure."